Good afternoon, everyone. Greetings from Bangladesh. First of all, I would like to thank AIMS and the organizer for having us here and giving us the opportunity to present our initiatives. So, I'm Dr. Sharmin Parveen from Department of Health Informatics, Bangladesh University of Health Sciences. On behalf of the other authors of this work, I'm presenting this paper, and I'm presenting some eHealth initiatives, actually, which is taken by the government of Bangladesh. And these eHealth initiatives are low cost, simple, easy to use, locally appropriate, and scalable eHealth solutions or ICT solutions for improving the health service management. And I'm going to give you some short summary of the eHealth initiatives of our government. Actually, this has happened because of the Digital Bangladesh vision of the present government. And government has given special emphasis on eHealth, and they have given special preference to have the to deliver the health services to the citizen through ICT. And having that in mind, Bangladesh government has established MIS, Management Information System Department, under the Director General of Health Services as a first step in 2009. And the purpose of this department was to ensure the ICT, best use of ICT in healthcare services, and to build and to maintain the nationwide health services and also the e-health services. And Bangladesh has made a remarkable changes or progress in this direction, and 13,500 plus community clinics and about 600 government healthcare facilities, 193 medical teaching and training institutions, 73 health administrative offices, and 24,000 health workers. Now they all are connected. That is the huge progress. I'll show you some more slides later. So here you can see the Prime Minister, Honorable Prime Minister, and the Minister of Health. They are having the video conferencing with all the district hospital health managers. And this is a short view of the eHealth progress in our country, and all facilities work in upward and downward referral links. And beginning from the community level clinics, we have 13,500 almost community clinics, and the data flow, if you can see, it goes from community clinic to union, then sub-district, that means the upojela, then district, then and the division levels, and medical colleges and super specialized hospitals. And all these facilities are upward and downward referral linkage. But this was not that easy. We had some hard realities because we have huge population, and Bangladesh has been identified as one of the 57 countries in the world where they are having the critical shortage of health workforce. So still we have that shortage, and the resources constraint for MIS, the Management Information Department, also the shortage of skilled ICT people, and also the competing health priorities. These were the challenges and hard realities before starting. Let me show where we had to start in a snapshot. This was the then MIS offices, and there was no internet connectivity. All works was paper-based, and there were poor work environment, and staff's understanding regarding the ICT or the ICT skills was not there, and there was no career prospect. The staffs were demotivated, frustrated, and the mail to send from headquarters to upojela level or vice versa, it took actually few weeks before. So then even the calls to call the sub-civil surgeons, 64 district civil surgeons, and it took almost 3 days to communicate with them. So what was the plan to improve the physical facility? improve the ICT backbone and data communication system, and improve staff skills and motivation. So this is the improved infrastructure, physical infrastructure, and in June 2010, and then the internet connectivity. So by April 2009, we have already the up to the sub-district level, that means up to Upazila level, the internet connectivity was established, but recently union and community level, there also the network has been expanded. And now there is a very wonderful innovation here, group SMS. I mean, all the health managers and staffs email IDs are grouped in this system, and the customized SMS can be broadcasted to one or more groups based on the requirement. And digital training facility also there. And the community clinics, as I mentioned, the community clinics now are having laptops. And by using these, we can have telemedicine, updating health data, health education, individual tracker in DHIS2, which as I'm going to explain later, training health staffs, communication, and internet browsing. These facilities are available in community clinic. So DHIS2, District Health Information System. This is the actually main or key factor for this silent revolution in our country. District Health Information System, Bangladesh enjoys the world's largest and best deployment of DHIS2 in national scale. And this has made this silent revolution. And why DHIS2? It is already well tested in over 50 countries, and there is a large community internationally on DHIS2. And the architecture is very flexible. In the implementation in a country, it doesn't require that much IT expert. Any public health people can customize it. So there are lots of advantage with DHIS2, and Bangladesh has implemented successfully. This is the dashboard from the DHIS2. Actually, it can take aggregated and individual level data collections can be done. Requirement-based reporting can be done, and comprehensive dashboard is there. And in this, the previous slide, okay, here you can see the data is entered at the source where it is showing the Burichong Upazila Health Complex, and the data set is EPI, infant and women data set. We have made actually a good progress in API. So a person involved either in Upazila Health Complex or community clinics or even higher levels, they can create, or actually the DHIS2 has the facility to collect, to analyze, and to visualize the routine health data. So these facilities we are taking very much successfully, and there are various kinds of charts you can make out of this system, and also GIS map can be produced from this. And this is a data flow picture of our Ministry of Health and Family Welfare system. I think I can skip this one because I want to show some more eHealth innovations. Telemedicine, as my previous speaker, he has already described the telemedicine system in our country. Actually, the Upazila Health Complex, there are two types of telemedicine services in our country. One is service provider, one is service recipient. So service recipient in the Upazila Health Complex, so patient and people come to have the services, they actually connect to the specialist doctor in the district division or the super specialized hospitals, but it has done on the roster basis, and they have the setup full, I mean the not the full setup, but we have some devices, telemedicine devices like the telestethoscope, teleglucometer, tele-ECG, or teledermatologist. We have seen mostly the patients come with skin problem and the eye problem. These are the two major problems we have seen in the telemedicine centers, and we have teledermatoscope, so the specialist can see very clearly the problems having the patient is having. But other services which have been given by the telemedicine services, that are interactive telemedicine service for video conferencing, learning and sharing of health related knowledge and events. And I can show you one more very exciting and innovation. This is the weekly management video conferencing at the management level. He is the champion of this actually routine health data success, Dr. Professor Ajad. He is the Director General of Health Services, and he is having the weekly meeting with the almost hundreds of health managers are there in division, district, Upazila level, and also community level. So they are having the weekly meeting over the video conferencing session by utilizing the telemedicine networks. And this is another example of the platform for learning and health related knowledge sharing. Other developments, we have Shastha Batan. What is this? This is a hotline 16263. So anybody can call this number and ask for the this is a type of call center, and ask for the assistance or for the health related problems, and it is well.
We should kind of wind up first. I'm sorry, I get 15 minutes, but the time is not permitting.
Okay, I'll try. So I'm skipping these. So other facilities are complaint and suggestion box. That is another very good innovation. So the number is displayed on the board in the Upazila Shastha complex or the district hospitals. So people can come to that hospital. They can call this number, or they can SMS the how to do this thing. It is displayed there. So they can SMS to this number whether they are having the proper service, whether the service is wrong or it is not giving proper service. They can lodge the complaint, and that complaint is attended by assigned staff there, and they will first to call the patient or the people. Did you do this, or are you complaining? Is it right? If say yeah, I have this complaint, it is right. And then the person will call to the authorized person in the hospital. So that's how they cross check, so whether it's a fake or it is really a complaint. We have biometric time attendance, and this is actually very good system also. And health bulletin, it can be generated monthly health bulletins in the district level and also the division level. We have human resource information system for making the thank you so much. For making the paperless posting of the staffs. Not only that, this system has another very good approach, that is support ticket system for feedback and issues. So ticket system is any health facilities, any worker or any staff can lodge the it's not complaint, can put the request to the concerned authority that I have this shortage of this thing, or I have this problem, can you please solve, and it is well attended. Okay, we have this scoring system, which is innovation and development of health system strengthening a score. So health system performance measurement scoring can be done based on their performance, based on their routine data and other activities. And there is another very exciting and innovative thing, and our programmer in the MIS, they have done, that is the development of a data warehouse. Why we need this? Because the data are coming from various sources, from the DHS2, from attendance system, from local health bulletin, complaint box, survey data, HRM. So we need to integrate this in a common platform. So there is a system which extract this data from all the sources and transform it, and then visualize and analyze by using Tableau or Click Data. It is a WHO recommended display software, and by utilizing this, we can display our public portal. This is a national dashboard where all it is open to all. Anybody can access this dashboard, and you can have all the health related information here, like the Shastha Batan dashboard, SMS compliant dashboard, biometric attendance dashboard, health workforce dashboard. Everything can be seen by accessing that site. And this is a slide which showing the recent flood affected areas in Bangladesh, because as I said, DHS2 can generate the GIS. And we have some eHealth initiatives as well. Apunjan and Baby Tika are two of the very good eHealth examples of our country.
I think we have to stop. Time is left.
Okay, okay. I just go through. Yeah. Okay, we have piloting shared health record. We are also piloting the vitalist civil registration. So all these are actually piloting right now. And international recognition also there. So it is well appreciated and well recognized by the international bodies, and Bangladesh won the award for digital international recognition for digital health award 2011, and other also. Thank you.
Thank you for spending time.
So, many of you must be knowing our neighbor countries, what they are doing. Bangladesh is one of the examples of their MI systems, very popular, and one of these credit goes to Dr. Azad, who has taken a lot of lead in that. So, ma'am, thank you very much for coming over to Delhi to present the thing. Any questions and comments from the audience? Would you please step back and see the questions? Yeah, just step back if there are any questions and comment. I just want to ask one question to you while they are thinking.
Please.
So you have done a lot of activities, we know, because we work together in WHO with Dr. Azad. You can just send my greetings to him when you go back.
Sure, sure.
So with so much of activities, have you done some kind of audit, analytics and published these data? I mean, I know there are a lot of reports.
Yeah, there are a lot
but
of reports.
Have you put it in some peer-reviewed journals?
There are some, because
Yeah.
they have published some journals internationally,
Yeah.
but still the evaluation and all these, the cost effectiveness studies, these are going on.
And that's my only suggestion. You can take it back to Dr. Azad, that you see enormous amount of activities happening in Bangladesh, and Bangladesh is one of the, it is LDC or LMIC? I mean, least developed countries. So anything good happening in such LDC is become an example for others. Am I right? I mean, Nepal also in the same category. I mean, so this kind of thing can be shared with other countries, and there are many organizations working, giving aid to Bangladesh, especially some of the open source softwares, like you
Yes,
said, OpenMIS,
OpenMIS.
the thought partners, and all
Yeah,
those things, all are working
Thought
there
Works
actually.
are
I know
also
about
working
that.
with
So,
this.
so please do a lot of audit and look back what you have done and what impact it has put on the health system. I know you are one of the country who was declared MDG.
Yeah.
You achieved MDG,
Yeah.
you got a credit of that.
Yeah.
But let others to know also. Because only somebody is accessing those data submitted to WHO or ITU. No other people can access it unless it is published actually. Like a Department of Medical Informatics, Health Informatics, Hospital Administrations. So please
Yeah, we
do
have a
that.
plan actually.
Yeah, please do that.
Yeah, our department is collaborating with the MIS,
Yes,
the
sure.
DHS.
Yeah,
We are planning to publish all these things.
Please do that. Thank you.
Thank
So
you.
no questions and comments from audience? Okay, so we thank you very much. We'll give you the gift after the session. Yeah.